Hello, Sia.
So, see us here. Yes, welcome. So happy to see you.
Hello.
Love the glasses, rocking those.
Oh, these are my broken ones. The other ones gave me a TC yesterday.
But that's why I'm saying the broken ones are totally your fit. They
They're
work
better,
too.
yes.
There you go. They serve their purpose. So happy
Yes.
to see you in those. The first question for today was, how did your epilepsy diagnosis make you feel as a woman? Did your perspective change on anything?
Hmm. Um, I think, for me, with the way that I was diagnosed, everything kind of happened at once for me.
Hmm.
So, I had already been going through about a year and a half worth of hell with the endometriosis and the adenomyosis. And so when I got the surgery and then 2 days later ended up in the hospital with the seizures, and the hemorrhaging, that it was it's like it changed my perspective on what I thought was so bad. And I was so obsessed with like trying to get the endometriosis and the adeno under control. And I had to take a step back when the seizures started up, because I realized, like, okay, this is not what's most important anymore. And so I think it changed my medical perspective. It taught me a lot about doctors and how to handle them, because I was going into it very naive with the previous conditions, just kind of trusting whatever they told me. Um, and that led to, the issues that I experienced with her doing the surgery, my surgeon, and screwing it up, and then now I'm left with things that are lifelong and can't be treated. Um, and so, yeah, I think for me and my diagnosis, it changed my perspective on a lot of things. And it also just really helped me understand what was most important. I was very depressed, because of the constant pain that I was in. And I've gotten to a point now where even though I'm still in daily pain, um, it's like I don't notice it the same anymore. I still push
Wow.
myself to get out there and do things and be there present in the moment, versus before I kind of put myself into a shell and hid away from the world.
Sounds like a lot of growth.
It was, yeah.
We talked a lot about that earlier, that
Adapting.
learning how to talk to your doctor is half the battle. Like, you wouldn't think that would be such an issue with most diseases, but with something like epilepsy, where you're just kind of throwing your hands up and guessing,
Well, yeah, and
you have to
especially
do.
too with like the fact that just like with epilepsy, endometriosis is so widely, uh, misunderstood, and there's just not enough information out there for it, not enough resources. I mean, the fact that we have to get a surgery in order to be diagnosed is just pure insanity. Um, and
I
it's
don't
so
even have a
unfair.
diagnosis right now. When I went to see the last time I went to see the urologist, because I never really established care. Like, they would tell me, okay, do this, and I could hear the bullshit and never really went back because nothing they did helped. But every once in a while, the pain would get so bad, and I would just go. And last year, I had a my seizure meds had worn down my kidneys, so I got a kidney infection, and I could tell the pain was getting worse, but I just thought it was, I didn't think it was a kidney infection. I thought it was just the endometriosis, like, flaring up. So I went to the urologist while I had that kidney infection, like the week before I was hospitalized, and they said, "Oh yeah, just pee in a cup and you still need to go do um pelvic floor therapy. That's why you're in pain."
Was
Because
that supposed to strengthen muscles? What was that supposed to do?
It's supposed to be therapy for the pelvic floor muscles because they believe that strengthening them leads to less pain, when in reality, exercise is a trigger for a lot of women with their flare-ups. Like for me, that is a trigger for me too. So it's not a fix-all, and it's kind of sad that that's what they go to.
I was in the hospital for a kidney infection because I couldn't tell that I had a kidney infection because I was in so much pain and I was used to the pain. So I didn't think that anything was wrong, and the doctor didn't even bother to look. So because she didn't really look, she was a nurse practitioner, of course, but then I ended up in the hospital for a week with a kidney infection. And anytime, even in the hospital, when I was in pain from the kidney infection, they would be like, "Oh, well, you have chronic pain and you have pelvic pain, right? This is normal for you." And I'm like, "Well, yeah, but if I'm inpatient, give me those fucking meds, because if I'm inpatient, I'm paying to be treated. I would
And
like to
monitored.
not be in pain at least while I'm here."
And also too, just because it's normal for you doesn't mean it's normal. They should
Yeah.
be actively going into these things to try to solve them. It's unfair to have to live in pain all the time just because it's a statistic.
That's totally unreasonable. So these exercises that you guys are referring to, is that the same as Kegel exercises?
I mean,
That's what I'm familiar with for like bladder issues.
that's for like bladder, and it can help to have that strengthened as well, but for these muscles, I think it's the abdominal wall and
Yes.
the I forget what they're called.
Okay, so
But
it's more than just like tightening. It's actually doing like lifts or
yeah,
something a little more extensive. Okay, I see what you're
It's
saying.
yeah.
it's also trying to pinpoint locations, because I was told that my when they told me to go to therapy, they told me that I don't need to strengthen my muscles, that I need to learn how to relax them,
Hmm.
because they were and that's why I was in pain, is because they were too stressed. But that's kind of, and the only reason they thought that is because I told them that it helps, a heating pad helps.
No.
So that's where they wanted to send me, but at that point, I mean, none of the medications they were giving me were helping. The only thing that was helping was a heating pad. Like literally, I took all of my Oxycontin from my last surgery, and I had held on to it because I don't take it unless I really needed it. And I had taken the majority of that for this, and it wouldn't work. Like I was in so much pain. The only thing that would help was a heating pad.
Did you
At
sleep with
least
that?
try it. Huh?
Did you sleep with the heating pad?
Yeah.
Oh, wow. Okay.
I got
Joyce
a
was on earlier today saying that she just figured out that sleeping with the heating pad doesn't work for her. It doesn't help.
the heating pad, it doesn't stop but my when I
I
get
think
a
hers is
flared
lower back,
pelvic,
like
I
lumbar.
have a problem with incontinence as well, and I can tell when a flare is about to come on when like I get an instant feeling where I need to pee, and then I go pee and nothing comes out, and that's when the pain starts, and then it just starts being like that, and then the pain will just get more and more and more intense, and it's always around my period time. And um they I mean, they know it doesn't have anything to do with my actual urinary system. They've already done those tests, so they told me it's most likely endometriosis, but I'll never have that diagnosis because I'm not going to get
They
that
won't do the
surgery.
surgery. Wow.
But either way, there's not really anything that they can do to treat for the endometriosis anyway.
Well, yeah,
That's
because the surgery itself, like you guys were saying earlier, it can cause it to worsen, which
right.
it has in my case. I started at stage 2, and now I have DIE, the deep infiltrating one, and that can happen for so many women. Like I think it's such a small percentage of women who end up having even just a year long period of time where they don't have pain. Mine was only a month. Um, so yeah, the surgery is like, the gold standard, like Keppra is for epilepsy. But the medications otherwise, all they do is put you on hormonal birth control, and not every single woman is going to be able to handle that very well. And
I
so
mean,
they don't have a whole lot.
they go off the fact that 10% of women have endometriosis, but that's only the number of people that have actually been diagnosed with it. And that is an insane amount of people for there to not have any other options, like treatment wise, besides birth control or surgery that makes things worse.
Yeah, talk about unacceptable.
I
Well, and then
just,
also too, like the adeno can be cured, I guess, by the hysterectomy. But then if you do end up getting that, because some women have the comorbidity between the two, if you do end up getting the hysterectomy, the endometriosis can continue and spread to your other organs and just continue there. So, there's just nothing. There's nothing for endometriosis outside of just the birth control and the surgery. And it does more damage than good most of the time.
I spent years after I got diagnosed with because I got um my I got diagnosed with epilepsy at 14. I was pretty much running around like a zombie until I was 18 because I was having so many seizures and all the different medications. And then once I was 18, that's when I started to get all of the chronic pain, weird symptoms and stuff. Well, I got it before then, but that's when I stopped taking my meds because I was like, fuck it, it's not doing anything anyway. So I stopped taking my meds, and then I thought that all those symptoms would stop, and they didn't. And I spent years trying to chase down those symptoms, trying to figure out what they were, and trying to get help for the chronic pain and everything like that. And all it ended up doing was bringing me to pretty much bankruptcy, and there was nothing that they could do anyway.
Yeah, I hear you on that. The amount of money that goes into the roundabout circle that they send you on. Go to the gastroenterologist, go to the urologist, go
Literally every
see
ologist.
yeah,
So
like
if they
every
feel
single one.
all if they feel all of those systems are connected, I mean, incontinence is something that happened to me for a lot of seizures before the RNS. Did that ever cause a flare up with some of your comorbidities, like a longer seizure that causes things like that, the incontinence? Did that like
Oh,
reflect
that's a
as
question for me.
pain?
Actually,
Both of you,
my
yeah.
like the incontinence is not really related to my seizures at all. Like,
Okay.
remember how I told you the other day, not the other, when I had that seizure, I will I used to be incontinent during seizures, but now I'm like, I'll go and go to the bathroom after a seizure,
Hmm.
and like I'll hold it in, but I'm incontinent whenever I'm in pain having these pelvic flares. But um yeah, so it doesn't have anything to do with my epilepsy, the incontinence. It's just
Okay.
it's probably just the endometriosis and how it's presenting, because that presents different in everybody too. That's what the doctors told me, but they pretty much said, and I appreciate the doctor that I talked to about this. He was like a specialist. He was an OB and a urologist. And he's like, look, I'm gonna give it to you straight. I see all your tests here. I see what's going on. You most likely have endometriosis. And here are your options. We can either cut into you and make it worse and give you a diagnosis that really won't change anything anyway. Or you can try pelvic floor therapy in a hot water bottle. But that was
Wow.
already after I'd already tried all the medications that they use to treat endometriosis at that point. So him saying, look, I'm gonna give it to you straight, I appreciated that because I didn't want to waste any more money trying to chase this if there wasn't anything I could do anyway, you know? I prefer for him to tell me that instead of, just not saying anything and you know what I mean?
Yeah, they just,
The
like
mystery of
they
it.
said, this is what your options are and live with it basically.
But
That's definitely,
I'd rather have someone say that to me straight than spend years and hundreds of thousands of dollars chasing it, thinking that there's hope of, and never actually, because the changing point was when I had to sit down and be like, okay, this is my life. I need to do the best I can and take care of myself instead of just throwing it at the doctors and paying them money to figure it out. I need to create my normal.
and just believing them and kind of going with the flow of whatever they suggest. Yeah. So the next question here was, would you rather do without seizures or your period?
Both.
That's an easy one. That's an easy one.
That's
I
a
would definitely do
Seizures for
without the
sure.
seizures. Yeah.
But I would rather not give up the diagnosis of epilepsy because I like the extra time and stuff on the perks. The epilepsy perks. I appreciate them.
I'm surprised you wouldn't be able to get that with the comorbidities. You do still have symptoms of these other diagnoses that technically you should already have, but that might cause a slowdown. You got to go
Oh, I know,
feel
but
better.
there's a little bit of a difference between calling someone and saying, "Hey, sorry, I missed that appointment. Can I get a refund? I had a seizure." Instead of, "Sorry, I missed that appointment.
I'm having really bad cramps.
I was hurting real bad with my cramps." Yeah, it definitely
Has a different ring to it.
yeah.
So what about you, Sia? Why would you do, or which would you do that?
I mean, I would want to do both, but if I had to choose, I honestly think I would go without the seizures more than the period. The issues that I experienced with all of it, like yes, I have to take Zofran. I can't take pain medications anymore. I have scars on me. It sucks. But the seizures have been the scariest part of everything for me. The possibility of having a brain bleed, my eye bleeding, my nose bleeding, my ears bleeding, all of that, like just everything with my head has been far more intense.
Terrifying.
Yeah, it's been far more intense than, you know, it that's why I said earlier, like it put it into perspective for me because I was like, okay, yes, this pain sucks, but I can lay down in bed for a little while, let it pass eventually. And it's 1 week to 2 weeks out of my month. But then with the seizures, even on the medications, the Keppra, it was doing good at first, and now it just completely tanked. So I only get 1 good week out of every month, and it sucks. So yeah, I would go
Thea,
without the seizures.
be careful because the medication that gave me the kidney infection was the Zonegran. And I didn't
Sonogram.
feel it because of the pelvic pain that I normally get. The only way that I knew that I had to go to the ER was 104 fever. So if you ever get the pain with the fever, get it checked out.
Okay. I appreciate you saying that. I haven't had um as many issues with my bladder as much as I have with my colon, which sucks. But yeah, the back and forth, that's why I'm on the Zofran, even though it has the interactions with epilepsy, with seizures. It can lower your seizure threshold. I get such severe nausea that I lost 80 pounds in a very short period of time. So
You should
it
smoke.
I take
I
drug
used to.
stuff too. I take um well, low-key, I take my grandma's that she had. I took her stuff when she passed away because I'm the one that needs it most. So she had
Yeah, it helps. It really does help.
she had
Wait,
some
which
yellow
one?
stuff, and I don't know what it is, but it helps so well with the nausea. It's like some really good nausea stuff because she was on like the morphine sulfate and whatnot, so it would make her super nauseous and whatnot. But
Is it a pill?
yeah, it's like a yellow pill.
Sounds
Um,
like promethazine or Zofran.
Zofran is like normally I think a little white pill or a dissolvable pill.
yeah, but this one is it was like a prescription.
That sounds like promethazine.
It could be.
But
But it does great when I feel nauseous, and it really helps.
Yeah, when
I
you're
only
feeling that
take it,
nausea, you cannot eat
yeah,
whatsoever.
I only
It,
take it when it's like really bad because I have
yeah.
limited supply, obviously. But yeah, it's
And
well,
that medication isn't any kind of cannabinoid for the nausea.
Cannabinoid? Oh, are you
Right,
talking about
the
like CBD?
that's not weed.
mm-mm.
oh, okay, that's not the medication that she's
No.
referring to. That wasn't any kind of cannabinoid
It's
that
an antiemetic.
oh,
It's
okay.
a prescription.
Yeah, I've never heard of that one.
Yeah,
They
there's
got quite a few out there.
I wanted to try the scopolamine patch for the longest time because there was less interactions with the seizures with that one, but it's so hard to get and they usually only give it out to cancer patients. But
Yeah.
I had that for I think it was like 48 hours after my surgery and it was like the first time I had zero symptoms of any sort of nausea or stomach issues.
Really?
That
Yeah,
sounds amazing.
it's very strong.
Mm-hmm.
Well, I that's the medication that they use for the dizziness as well. Like, no, okay, I'm thinking of something else. Because the scopolamine patch, there's one of those, not one of it's either that or something else that they said works as well as a placebo. Like it doesn't really do anything besides it doesn't do any better than a placebo, but I don't think it's that one. I think it might be the one. It's like Gas X. Gas X is the one that's not any better than a placebo.
Oh yeah, that
Um,
one's like over the counter.
Yeah.
Scopolamine's like pretty heavily regulated. My father-in-law was on it with his leukemia medications because he was like in such bad shape. Like it's kind of weird how similar it was for me. That's what kind of got my
what kind of
doctors to
insurance do you
thinking.
have?
I have Anthem right now, but I was originally on Blue Cross.
Prescription wise, who's your PBM?
I have Express Scripts right now.
Um,
they had a hard time filling my nasal am. That was rough for them.
Yeah.
What, based
So
on
I
cost, or did you have to get some kind of authorization?
It was based on cost, and then they also were like super sketched out about how strong of a medication it is.
you had to get approval.
Yeah, and it took like a whole month.
Wow.
If you have any if anyone has any questions about trying to get their medications approved through insurance, please give me a message because I can help you with that for sure.
Work your magic.
That's that's probably the main reason that I'm working with Caremark is because they are the best epilepsy job you can get.
Hey, it's a beautiful thing if you want to share what you're good at. I mean, that's why like 9 out of 10 of us come back here so much because we know these seemingly irrelevant things about how to help what we go through ourselves. And if it helps makes a difference to somebody else, like I was really impressed to hear, Hannah, that you got in touch with a doctor so soon that actually wanted to go through with the VNS, wanted to go through with those all the tests that it would require to get to the source of, like, get you approval for that surgery. They would have to prove what kind of seizures you had and that this would help. And getting to that center, maybe those level fours, the epileptologist really would have been like the right way to go from the beginning. I driving those 2 hours to get to that doctor, maybe I should have gone that route. Do you think your level
Well,
4 really made a difference? Like you saw the right doctors?
yes, absolutely. If I was treated in Medical City, I probably would be dead by now. So,
All right.
well, I mean, but keep in mind, I spent about a decade and I went through over 20 medications. And by the time they were considering me for a VNS, I had no other options left. They didn't want to go through with that, but they knew that they had to, or else I would most likely not make it. So that's why they did that. There was no, if anything, they tried to convince me because I just, at that point, I was just so tired of being on all these different medications and feeling like a chemo patient and all of this shit that I was just like, you know what, whatever you need, just get me off these meds.
Yeah,
Yeah,
that
that's what
that's
got me most excited
understandable.
about the device too. The promise
Yeah.
Yeah.
that it was going to stop. I mean, did they kind of sell it to you like that though? I felt totally gaslit after the
Well, they
RNS
did.
got turned on.
They said, even with this device, you will most likely have to take multiple medications for the rest of your life. As soon as I got the VNS, um, immediately my seizures were less severe and I would come out of them faster. Over time, they became less frequent, but they were still bad. And I ended up starting Xcopri, and now I only take Xcopri and Klonopin. I mean, Klonopin as needed, but um, I used to be on the highest doses of 4 or 5 different drugs at a time, and now I'm just taking one, which is great. And hopefully, after they turn on the RNS, I'll be good to go. Because I was still, one of the main things I was concerned about was, I mean, the whole political climate, everything's so expensive. What happens if I can't afford my meds? I didn't want to have to rely on that when,
You're going to get
especially
hooked
with
after
what
the
I
first
do, I
dose,
know how
basically.
hard it is to rely on medications like that. So I was like, you know what? Do everything you can to give me as much coverage, as much protection as you can, and whatever, that's fine with me. It makes me feel better knowing, like, if I miss a day of medication that I'm not going to have a seizure immediately, that I have at least a little bit of fallback.
Yeah, that's definitely reassuring to
Did
have
you
some kind
feel
of
it when
plan
they
B.
turned it on?
I didn't feel it as much as I do when they program it. Like, when they're adjusting the settings and they say, okay, it might zap. I think I'd only feel that. I didn't take notes of feeling the RNS, like no extra notes on the RNS day. And I know it's been a couple years now, but I probably would have jotted that down if something felt weird.
Yeah,
So no,
I'm
I don't
excited,
think I
if
felt it.
anything, because they're gonna turn it on in about a week. So fingers crossed.
Yeah, absolutely. No, so are they planning on if the RNS takes hold, doing what it's supposed to, is the VNS chance maybe gonna get taken away?
No, they have me on the highest level for the VNS,
Okay.
and because it's supposed to work over time,
Hmm.
they want to leave it on as much as I can handle. I think they're hoping to take me off, like reduce my medication, because my medication is still, it might be just one medication, but it's still like one of the higher doses. So I think if anything, they're just going to try to make it so that I rely mostly on the device. But I do have to pop off. Thank you for I mean, it's been great. Thank you so much.
Absolutely. We're here Tuesdays and Fridays are the regular days for meetings, 12 Pacific time.
And we're
Okay.
happy to meet you.
Yeah, very happy to meet you.
I guess I'll see you guys Friday then.
Thank you for
Sounds
contributing. We'll
good.
see you then.
We have a new
And
person in.
welcome. Yes, please take it away.
Hi, Nikki.
Hi,
Welcome
how
in.
are you all?
Good. How about you?
Oh, rough day, rough day. But yeah,
Well, now you're here to
struggling a
kick
bit.
back and relax.
Yeah,
Yeah,
I
it's
like your
comfort zone
hair
here.
out.
Oh, thank you.
How are you, Lufa?
I'm hanging in there. How are you?
I'm doing all right. Yeah, hanging in there. I
Oh,
went to my neurologist today.
How did that go?
Um, well, she told me to go back to my epileptologist. But
Okay.
I don't know. I think I said that before when I was on here that they diagnosed me with FND and PNES. Um and so right now I'm not on medication and basically every day I'm having seizures. Um and so I they want me to go to a psychiatrist um and uh, speech therapy and occupational therapy. So yeah, my brain is fried, but
so
yeah.
in advocating for yourself, how I don't know a better term. I mean, just how stubborn are these doctors in not believing that these are physical seizures, not the the kind that look like seizures but they're not. Is it really all based on like one clean EEG?
I had multiple. Well, I had a couple of 30-minute ones, and then I had two at home ones that were 72 hours. And then I had a EMU stay. That was my first one, was 72 hours. We tried the Keppra. I was on that for about 5 years, and it really didn't stop these. And I had a brief period where it was okay, but they said maybe that was a placebo.
Really?
And then uh, I forgot what I was.
The Keppra, you were on the Keppra for 5 years, but that didn't really help much, and the
Yeah,
seizures
yeah.
didn't seem to stop. I mean, I'm just trying to figure out why they're not actually trying to get to the bottom of this. If you're not getting better, you are feeling worse now that you're not taking any AEDs.
Uh-huh. Yeah.
Do you feel like anybody is being proactive about diagnosing you
No,
correctly?
unfortunately, well, they did, my epileptologist did tell me I could get a second opinion. Um, that doctor I don't get to see until January.
Mm.
And yeah, she also said I could get another EEG. But yeah, I'm guessing it will probably be normal because whatever is going on, I think it's deep in my brain and it's not gonna be picked up on an EEG.
And nobody's mentioned subdural ESEGs to you.
No, no. They they wanted to see, they wouldn't even adjust my medication until I had a EEG that actually showed a seizure. So I was on that same 1,500 milligrams of Keppra for 5 years.
Did you make note of feeling a seizure during any of these EEGs? It should have shown
Uh-huh.
up.
Yeah, yeah. Yeah, that's why my second EMU was 20, it wasn't even 24 hours. And I had
Okay.
14 events, and they came in, they say, yeah, you can go home. It's like they're not showing on the EEG.
But you're
But
having events in front of other medical professionals, and nobody's
mm-hmm,
talked about escalating it to the EEGs that could see deeper.
no, no, that has never come up. It's just been um, psychogenic or now most recently FND. And because when I have the episodes, I lose my speech or my ability to speak is, uh, I can't get my words out. That's why she said to go, she wants to refer me to speech therapy, occupational therapy for the TODS paralysis, and um, psychiatry for an evaluation.
Okay.
So,
So do you plan on at this point just bringing your suspicions to the second opinion in January?
yeah, yeah, I'm gonna
Okay.
do
And
that. Yeah.
maybe asking them about another EEG that would see deeper?
Mm-hmm. Yeah, I'm sure that that
Okay.
doctor will
So
ask for it. Usually they do that. As soon as they see you, they ask for a EEG.
right, right. But at
So,
least you can mention that you've had EEGs before and the
mm-hmm.
symptoms. I mean, do you have any symptoms that might indicate like a hippocampal foci? I mean, is it always memory or
I don't know. I mean, from what I've researched just on my own, my suspicion is there's something um, in the parietal lobe because of my symptoms. I get a lot of tingling and like I get the roller coaster stomach thing, but I also get tingling and pressure sensations, and also when I do twitch, it's very slight twitching, like you almost can't even see it. And most of the, I guess, the disturbing symptoms are like just feeling like sometimes like my leg is not quite there or my arm
Mhm.
is not, and it's always on the left side, it's always on the same side. And I kind of lose my balance and I get disoriented. And
Okay.
yeah, my speech, they're very different. So I think that uh, I'm starting to see that that's kind of probably the reason why people think I'm making it up, or maybe,
Yeah.
that it's like um, psychological. But when I did some research on parietal lobe seizures, and I've seen a few people post on the epilepsy subreddit about them.
Right. I'm seeing like
There,
the visual illusions, that tingly feeling
yeah,
that you described, some numbness.
uh-huh,
Okay. So I mean you have your suspicions of that, but this is also, has to be diagnosed by EEG, same way.
exactly, yeah, and it's hard
Okay.
to get them on an EEG because I think they're just in a very tiny, tiny part of the brain that's causing those sensations. So yeah, the reason why I don't think it's FND is because they seem to be triggered by the same thing that regular seizures are triggered by: the heat,
Okay.
uh, like sunlight. If I'm riding in the car, the sunlight going through the trees,
Whereas
And
FND is more psychological triggers, the stress and whatnot.
um, I don't, well, I think FND is more so it is a stress response, but I think it's like a long-term stress response. So it is
Oh, okay.
possible that, it could be both. But when I look at the FND symptoms, I mean, like some people wind up having problems with walking and talking, but it's more of a long term. It's not so much episodic.
Okay.
Um,
Yeah, that makes sense.
yeah, and I guess they're still learning about all of that stuff. So, they could say, "Well, you have that too, and we just haven't seen it yet." I don't know, but
And there's
um,
never a straight answer for anything.
yeah, they're still learning about it. I do believe that there is something there as far as like people who have been in very stressful situations and now their nervous system is trying to deal with it.
Compensate after the fact, yeah.
Yeah, yeah, I do think that that is very possible. But um, for me, I don't think that that's the case because of the triggers. And also, it's like if I don't eat, I have to make sure, and it's been this way my whole life, that I have to make sure that I always have some kind of food. If my blood sugar gets low, I get those
Oh,
symptoms. Like I said, the heat, this sunlight. I actually am one of those people that's photosensitive. So when I went to the
oh,
eye doctor yesterday, all the things they do, they flash the lights in your eyes, and I was really a mess after that. Yeah,
yeah, that probably caused some stuff.
yes, it definitely did. And I went to the
Mm.
dentist too yesterday. So
Oh, and those lights, those are a different kind of bright light.
yeah, yeah. At least I had the glasses on for that, the dark light, the glasses. But yeah,
Yeah,
eh,
pretty little doctor glasses. We
yeah,
all
yeah.
know
I
about that.
always try to keep them.
Exactly. Let
Uh,
my children want to dress up in something, and that'll get it done.
oh, the glasses.
Yeah, yeah, that's a easiest dress up. Way better than having to dig out the Halloween costumes again.
Oh.
So we asked a question a little while ago, and I don't think I even got Lufa's answer. Would you rather give up seizures or your period? If you could do without, which one would you definitely do without? I went with seizure.
Seizures. Because I don't like the medicine.
Okay.
I hate the medicine. I hate the seizures, but I hate the medicine as well. So it's like a lose-lose
Yeah.
situation for sure.
Yeah, that makes sense. What about you, Nikki?
What was the question?
Would you rather go without your seizures or your period? If you could get rid of one or the other.
Oh man. Well, I feel like my period is causing all the problems. So I feel like if I got rid of that, then I probably wouldn't have as many seizures.
Oh, okay.
Definitely. Yeah. And I have
Yeah.
brought that up to my doctors many times.
And did they ever try to go like an IUD or a depot route, just messing with
No,
your hormones? Okay.
no,
I wonder why. If you bring that up to the neuro, they don't even talk. Or no, you said OB, right?
no, my neurologist, yeah.
Oh, okay.
Mm-hmm.
And they didn't even try to tell you to talk to your OB about it?
Mm-mm.
Wow. So that was just like letting you vent about it and say, okay, best of luck.
Yeah, right.
Oh, that's got
They
to be
act
so
like they're
disheartening
so
when your doctors
puzzled.
just don't listen to you. Or
What's
they're
that?
confused. They're acting more confused and not like they're just not listening.
Mm-hmm. Yeah, like they just don't like. I think that once they have like an idea in their head of what they think you have, then everything else is kind of dismissed. It's like, okay, you just need to go to the psychiatrist and, they can help you with that. And
And the more we talk to people that come with these false diagnoses, essentially the PNES and things like that, that's the impression I get, that once a physician opens a chart and they see a diagnosis on there, it's really, really hard to prove otherwise
hmm
or even get them to want to.
yeah, yeah. exactly. As when I went to my neurologist today, she she said, "Oh, you need to go back to your epileptologist. They handle seizures." And I was thinking, well, my epileptologist told me they can't help me. So I guess I just wait for the second opinion doctor.
Yeah, I mean, hope if
Yeah.
anything, you're definitely doing all the right things by establishing this trail, showing that you've been proactive in your care. Obviously, these specialists are not even figuring it out. So at least when the epileptologist sees it, yes, she'll see, or he will see the chart, but hopefully they'll have access to seeing how many other physicians you've already been to, and to no avail.
Mhm. Yeah.
Yeah, that's understandable. So it does take a long time, but I'm proud of you for sticking with it because you know your body best.
Yeah, thank you. I um I have lost a lot in the past few years. Just my function overall. You know, I'm not able to work. I was never really able to work full time, but I used to be able to do a little bit more than what I'm doing now. And now my husband is basically my caretaker. Like even when we went to the doctor today, usually he'll drop me off and he'll go get something to eat while, I'm at the doctor. But I was like asking him, can you go in with me? Because I'm not sure if I can even make it to the elevator. But I was okay. I did go in by myself. But when I
But
went
God knows
in,
you deserve that support. You definitely
yeah,
deserve that resource there just in case.
yeah, just in case. Yeah, he was asking me,
Absolutely.
he's like, are you sure you're gonna be okay? And I said, yeah, I'll be okay. I'll go in. I said, well, I am going into a hospital, so if I need help, then there's plenty of people here. And actually, when I went last time, there was a woman having a seizure outside. And
Oh wow. And you got to witness that on the way in.
yeah,
Oh
that wasn't
boy.
great.
That
And
must have felt like a sign.
yeah, right. And but I don't have those kind of seizures. Now I did have a few when I was a child, but they got them under control really quick.
So you were
But
on medications when you were younger?
oh yeah, yeah.
Oh,
I was
okay.
born with epilepsy. Um,
And they kind of okay, so in your childhood years, you had one of those, Dravet syndromes or one of those diagnosed, but in your adult life, am I understanding this? Now they're saying it was always PNES or it's changed?
they're saying that now I have PNES. Yeah. Um, when
That's
I
unheard of.
was a child, I had tonic clonics. That's well, my mom said that she noticed that I was like really kind of a drowsy baby, like more than usual. And she kept trying to bring it up to the doctors and they weren't listening to her
And this was
until
before medications.
this was before medication, until I
Okay.
had a grandma seizure. And then they took me to the hospital, and at the hospital I had another one, and they
Hmm.
diagnosed me with epilepsy. I was 4. And then I had another one, um, and I think they added another medication or something like that, and they got those under control. But then I
Hmm.
started having absence, and she said I had a lot. Like, it's interesting because a lot of people who have childhood epilepsy, like they remember their seizures, but I don't really remember. I guess because they were generalized. Like I just remember that people always said that I was spacing out all the time. But I had those up until age 14. They took me off the medication because they don't want you to be on it if you don't have to, because it can be damaging as you're developing as a person.
It's understandable.
Yeah, so they took me off of it because they felt like they had everything under control. So I went all that time uh, with no medication, like into my 30s.
Oh,
And
okay.
uh, it's one of those things like you have symptoms when they start getting worse, then you kind of look back in retrospect and you're like, oh, was that a seizure? And I just didn't know. I didn't know anything about partial, whatever they called them back then, partial seizures. I
Yeah,
didn't know
focal
anything
or whatever.
about it. Yeah. So every time something would happen, I would just be like, oh, that's just a weird thing that happens. Like, because I remember when I was a child having the like nausea before, I guess maybe it was before absence seizures. I would feel nauseous and I would tell my parents I smell garbage. And
Oh, okay.
yeah, I remember that, but I don't
So you think that
remember.
was your aura in a sense?
Yeah, I think so. Yeah.
Okay.
And I would say, my head is floating away. I was such
Oh,
an
wow.
interesting child to be around, but
I bet.
yeah. So, yeah, it wasn't until I just started looking back on those things when I was having these other sensory symptoms and wondering, are these seizures? And of course, I started looking on the internet, and this has been like 15 years of trying to figure this out.
Yeah, so into your
Yeah.
30s without those medications and then these misdiagnoses, and that's another obstacle to overcome in itself, it sounds like.
Yeah, yeah, trying to get people to look at it. The first neurologist I went to, she said, I think you're having seizures. And she referred me to a specialist. And then I had the EMU stay, and they put me on Keppra, even though the EEG was normal. They said, well, we still can't rule out epilepsy. So we'll
Yeah.
put you on Keppra and see how that works. And actually, I didn't get the Kep rage. I was like cranky with Keppra, but I didn't get rage. But I did okay at first. And then actually when I was looking back at my records, I saw that I actually asked my doctor if I could decrease my medicine because I'm one of these people that really doesn't like being on medicine.
Is it
And
because of the side effects or just how you feel like it's really taken a
yeah,
wreaking
because
havoc
I
on your
was on
kidneys?
medication for the
Okay.
first, yeah, the like, yeah, 10 years of my childhood, I was on medication. And
That'll do something to
yeah, it did. It caused a lot of like gut problems and things like that that I still deal with. So
you.
I didn't really want to be on the medication long term. It was like, okay, can you fix this? And once it's fixed, then I'll be fine, That's not really the way it works. But my doctor actually wrote it in my chart. He's like, yeah, she wants to decrease the medication, and she thinks her diet is helping with the seizures, and I think it was, but it feels like you try something and it works at first and then it stops working.
Absolutely. Long-term solutions, especially for seizures, are hard to come by to say the least. The thing about the diet, though, was it a Mediterranean diet or something that has been proven to help with seizures?
It was, I don't even remember, to tell you the truth.
Oh,
I know
okay.
I was doing MCT oil because he put that in there.
Hmm.
Um, and I was doing, I think I was doing keto at the time, but I didn't stick with keto because it was too hard. But I did stick with the MCT oil for a little bit. And he actually put it in the chart. He was like, "Oh, okay, that's interesting. I'm glad it's working for you." But, you know, then after a while, it's like either it stops working or you forget that it was working and you forget to take it. So I'm not sure which one it was.
Yeah, that's rough to have to circle back around. So there is a post here now of somebody who's just in a frustrated situation. Let's see. Had a seizure, can't drive, moved back with parents, and I can't make anyone happy. Besides chronic illness, I had a random 5 minute grand mal seizure 2.5 months ago. At the same time, I was very sick with things that 3 doctors told me was unrelated. So I moved from my apartment back to my parents as it's a rural area and need to get a ride to go anywhere. There's 0 jobs within walking distance. Can't drive for another 3.5 months because of the seizures. That's how long it'll take to get to 6 months. And I'm on my parents' car insurance to make things cheaper. So when I had a seizure, I was already winding down with my seasonal job. And because of all treatments I needed, I quit. The job I had before was amazing, but I was laid off due to COVID and it's 45 minutes away. I've been job hunting and told my family I was going to drive today. I know, bad, but neurologist ruled my seizure at random and said he highly doubted it would happen again. I went to a job interview and may have scored a job, but I'll need a car because I'd be showing apartments and the apartments are pretty spread out because of the nature of our area. Of course, I came home and my parents flipped, even though I told them I was driving. My mom is angry that I'm low on money, but is mad about me having to drive to get me places. She's pissed that I need help with bills, but she won't drive me to a workplace. And of course, if I have another freak seizure and hit someone while driving, we'll get sued and have zero money. This is not how I imagine my life to go. Every time I take a step forward, it's two steps back. Not driving when you live miles anywhere is just, I feel helpless. I've always driven myself everywhere. I'm 25. I feel like none of this is fair. Again, I have bills to pay. I need a job. I'm going insane. I don't know. If anyone who's had seizures or knows how this is, can you help? I'd appreciate it. So frustrated. So, does anybody else feel like they're still in this denial phase?
Oh yeah, me. But I mean, it's kind of hard because my doctors think that it's psychological, so it's hard for me to think that I am disabled. Eh, Yeah, my husband says a lot that I have magical thinking. Like a few months ago, I was like, I'm gonna be a data analyst.
That would sound like a compliment.
Yeah. Yeah, I'm always trying to do something, and he's like, "Really? You're going to be analyzing facts and figures and going into meetings with people?" And
But it's remote, it's working from home.
it is, see?
Exactly. This is where you can come because we see the logic. I'm right
Yeah.
there too. If the kids would shut up, I could do the telemarketing thing again.
Oh boy, I've done that.
You know,
I'm retired from telemarketing and customer service.
there you go. See, I just couldn't take the credit card numbers anymore when I was collecting medical bills. They
Yeah.
called the
Mm.
company out too much on that. The rep just went silent. Now she has all my personal information and they freaking out over that too many
Oh, oh
times.
wow. Oh no.
Yeah,
That's not good. See, the thing is with my speech, like when I have a seizure, my speech just goes. And there's no way to really mask that, like, or I just start stuttering. So,
exactly. So if anything, that's almost a visual symptom, like you said, something you can't mask.
hmm yeah. But I tutor sometimes
Oh,
2 hours a day or 1 hour a day. So that's the work I'm able to do.
there you go. So the skills
Yeah.
are there. That's amazing because
Yeah.
over time, a lot of people lose even those skills.
I know. Yeah, it's English as a second language, so their expectations are not very high. I speak English, that's it.
Okay,
But
okay.
yeah, the poster, I think, when I was listening to it, that maybe I hate to say it, maybe she's not being realistic about her situation.
Yeah, that is what it sounds like. She already said she's 25, lives in a rural area. When you realize how much of a difference public transportation can make, and it's for that reason because you can't use it, that's a tough one to get over. But
Hmm.
this is definitely like all that energy you're putting into sneaking out to getting a job that you can't keep.
Yeah.
Maybe I would
Mm.
find a better way to phrase that of use that energy to see what programs are out there. If you can get a ride to some kind of appointment to, I don't know, talk to family, aunt and uncle, somebody else who lives closer to a city.
Hmm.
At
Yeah, I
that point, I
agree.
mean, maybe living at home might just not work. At 25, you're
Yeah.
not helpless, but you're definitely not on your own yet
The work from
nowadays.
home too.
Yeah. What do you think, Sia? You think they just sound defeated?
Yeah, I mean, and I can kind of understand that because I'm gonna I'm not in a similar position as like work, but as far as like family life, um, it's been very back and forth between family wanting to be supportive, and then the next second they're, telling me it's BS and that I need to get my shit together. Um, and now even with the diagnosis, it's still happening, and it's like, okay, yeah, cool. But I mean, I myself have moved past that denial. I know I can't drive. I don't want to risk that ever again. But I still like push myself too hard. Um, like I with yesterday, the whole thing, I had a TC yesterday to trying on new glasses, and it was a bad one. I I had like severe chest pain when I woke up because I the muscles in like my chest and my lungs, I don't know what they were doing, but my husband said it sounded like I was like gasping, and like air was like escaping and none was going in. Um and then, I get up an hour and a half later, and I'm like still pretty out of it from the nasal am. Um and I'm thinking in my head like, yeah, you know what? I'll get up and I'll try to help finish out the night because I feel bad if I don't. And then what ended up happening was that halfway through bedtime, my left leg just started going completely numb, and it scared me because I was like, okay, I haven't felt this before. Like normally it's my right leg. I have numbness in my right, but not my left. And with all the weird things happening lately, it worried me. And then that upset everybody. Like, oh, you couldn't finish, bedtime. Now we all have to pitch in and help my husband, my mom, because, and, you can't do it now. You have to lay down in bed, and we're all tired from work because we have to work to make a living, and that's like the constant thing that's brought up. So it's hard. It's hard when you're living with family. It's hard to like let that denial completely go. Because even if you yourself and even your doctor team know what's going on, it's still hard with family that doesn't understand, doesn't try to understand or learn from what you're going through and be supportive. And with that poster, what she said about her mom, I mean, that is hard. Like she herself, she might be trying to come around to it. Even though it doesn't sound like it, I know, but she might be trying, and then with all of this pushiness from everyone around her, she feels like she has to be doing something else still. And it's the back and forth of like, no, you shouldn't do that, you'll get hurt, and then why aren't you doing that? You know, it's difficult.
Yes. And nobody would ever admit to hypocrisy. That's just too far to
Yep.
ever ask like a mother, a spouse, or somebody like that to admit to being a hypocrite, even if you're not saying those exact words. All the insinuations and suggestions are there.
Yeah.
You can
And that's
call
where the
it using the
gaslighting comes
facts.
in.
Exactly. It's like using the facts against you, just spinning it in that way. So
Yeah.
yeah, I'm glad we're past that point, but not entirely. Because
I
we're
don't
all
know.
still
I
alive and
wonder
gotta
if it
make
ever
it.
does like go
That
away
that's
completely.
that's what I'm thinking. Now we have this
Yeah.
this resource, and that's what I'm thrilled about. But we're still trading favors. I mean, I
Yeah.
got like 3 hours tonight, and I know nobody's doing dishes for a long time, so it's all
Yeah, I
good.
did a whole bunch of things this morning just so I could have tonight.
Ex and I knew I was expecting that you would do something like that. That's
Yep.
incredible, and you're still recovering.
I
You're
am,
still
but
recovering.
you
Those
gotta keep
those
pushing.
oh, oh, see, you're just more and more amazing every night. Every time we
Thank you.
see you.
Oh man.
And I'm saying every night, and over there it's still like middle of the day, isn't it? Your Pacific time,
Yeah.
right?
Yeah, it's 3:39. Kids just went down for a nap.
Ah, beautiful.
Yep.
Love it when that happens.
I know.
So just to raise the spirits a little bit, we've got
5:40 here.
another
What time is it for you?
here.
Oh, Kate, you're cutting out a little bit. Alufa, it's 3:40 here.
Oh, okay,
Oh.
Central, right? All right, I'm 640 on
Yeah,
hotel
5:40.
Wi-Fi, so apologies.
All good.
Now, what we're in this post, they're saying, here we are, Nikki, by having a seizure in front of at least 100 people in the ER's waiting room. I felt so powerful saying, listen, I just had a seizure in your waiting room while I waited 8 hours to talk to you. I need this to stop and I need you to help make that happen. I finally got some medication, not a daily one, but essentially the emergency inhaler of seizures. So when I have an aura, I can stop them. I also have an appointment with a specialist in less than 2 weeks now to hopefully figure this out. Keep going back to the ER. Keep going to different doctors. Keep pushing. Your health is in your hands and it's fucking exhausting, but it feels so good when somebody finally says, let's see if we can finally find a way to control this instead of, are you sure? There's nothing we can do anyway. I know this isn't the end. I know I will have more seizures, but the fact that someone finally gave enough of a shit about my suffering to push for medications is vindicating as hell. You're worthy of care. You're worthy of being listened to. You aren't making it up, and you deserve to be taken seriously. This girl sounds on cloud nine
Yeah,
to actually
that
get that
is
first referral. Yes,
that is awesome.
that's reassuring to at least get the rescue med. But on the flip side, Nikki, you said you had a seizure in front of a bunch of people in the ER, no?
No, not in the ER, in the
Oh,
E
oh,
EMU.
you. I'm sorry. Yeah,
Yeah.
that was it. Is EMU emergency medical or something?
The epilepsy monitoring unit.
Oh, and you had a seizure there, and they're still not giving you credit for not PNES.
Because I didn't have a tonic clonic. I had
Oh, just an absence of
the same
something.
things that I have, the, sensations and I guess for most of you it would be like a aura. That's basically what I was having. But I have those in clusters. So I
Oh,
had
okay,
14 in less than 24 hours. And those were the ones that I pressed the button because I really got tired of pressing the button. And
gotcha.
yeah, so I think those are hard to catch on EEG anyway. But yeah, my doctor said 99% of the time they're able to catch them. So,
Hmm.
It is important, because I heard your story and I just wanted to share too, from my experience dealing with the PNES diagnosis that um it is important to get the second opinion because the first neurologist that I went to and the first few hospitals that I went to, they all told me the same thing. It didn't show up on EEG, so it's not there. And you just have PNES. And they refused to put me on any medications. And it wasn't until I had an abnormal MRI that I finally had an argument with the DO at this hospital that I got life flighted to. And I was like, dude, you are not going to tell me again that this is PNES. You are not going to tell me that this is FND. I had the woman next door to me in my room. She was diagnosed refractory, about to head to Stanford, and even she was arguing my case. And he told me, okay, here's Keppra, and it's the gold standard, and it's probably going to be a placebo effect. Um, and I've been on it for 3.5, almost 4 months now, I think. And I'm even starting to notice the downward spiral and it, being helpful in controlling my seizures. It is not the only medication that's out there. And in getting my second opinion with another neurologist, he finally told me, I can't believe that you've been misdiagnosed this long because I've looked over your EEGs and it's clearly evident from what I can see that you have RTLE. Um, and it's so hard for majority of doctors to diagnose because they don't know the signs, they don't know what to look for, and they're looking for one specific thing, and it's hard to find.
They might not
Um,
even be looking in the right side of your brain.
exactly, exactly. So it is so important to get a second opinion because I'm not doing the greatest on the Kebra, but I have an appointment with him tomorrow. He's gonna change up my meds. I got more tests with him. Feel far more comfortable with him. And he has been spot on with everything that he predicted so far. So
Mm.
it's good.
That's
You
a good
can
sign.
find somebody that can help.
So, Sia, you had tonic clonics and they said that they were not on the EEG?
Yeah, I was having tonic-clonics and focals on the EEGs, and all of the hospitals that I went to, they all told me that nothing was showing up. And it wasn't until I had an actual neurologist in an office setting as a second opinion finally look over them himself. And he's known, I researched him beforehand, he's known for finding things that majority of doctors don't find. And he was able to figure it out from that. And so he's getting more evidence for me on paper by doing more tests. But yeah, it went unnoticed for a very long time. And there are a lot of people with, I have right side, people with left side parietal lobe. There are a lot of people that have, clear EEGs, and they get misdiagnosed for a long time.
Mm, yeah. I know I hear about it like on Reddit and other forums, but when you go to the doctor, they make it seem like that never happens.
And that's the thing too, they love to gaslight people. They do. And it's all about keeping you in their care, not to have you go anywhere else. But it's not true. 99% is not an accurate representation of what they catch on an EEG. And in truth, it really shouldn't even be the only, thing that they use to diagnose people because clinical signs are just as important as the EEGs and the MRIs that you get. It all has to be used in combination together.
Yeah, I mean, it makes sense. I did have an MRI too, and I have a white matter lesion on my frontal lobe. But they said that it's so small, there's no way that it can cause the symptoms that I'm having now.
That's even more
So,
reason to get a second opinion for sure, because they told me that my tonsillar ectopia was so small, it hadn't moved very much, that it was unnecessary to look any further into it. Lo and behold, my most recent MRI that I had done with this new neurologist showed that it spread down even further.
mm,
And his assumption with this is that it's the pressure building up inside of my brain that is causing it to go through the base of my skull and push down the brainstem. So, yeah, you definitely need that second opinion. Don't lose hope on it.
thank you.
And hear this out, Nikki. White matter lesions, everything, you said sometimes associated with seizures, but check this out. They are in particular associated with late onset epilepsy. So if they're trying to say that, everything that was happening as a child is not the same thing anymore, this itty bitty white matter lesion might have something to do with that because these are proven to
Yeah,
associate late onset, the risk of seizure reoccurrence later in life. That's exactly what white matter lesions do to patients.
wow. And they
So
would
it
not
sounds
look
like
at
you
it.
have your data. I mean, you have the right to your own data, your own EEGs, and run off with them to somebody else because they've got to be able to give you a more detailed analysis with some professional.
Don't let them minimize it.
Exactly. Nobody's
Mm.
going to write that off for you. And now I forget where I was going with.
Mhm.
Had another thing pulled up that I saw late onset. I'm thinking, whoa, that's you. Okay. Anyway, one of the questions we asked at the beginning was a lot about pregnancy. Have you ever been pregnant? I'm sorry, Nikki.
Yeah, I have to. They're almost grown now.
Okay.
They're teenagers, 19 and 16.
And this was around the
Yeah.
time when you said your seizures were for the most part controlled.
Is when, yeah, well, I thought they were controlled. It wasn't that bad. If you ask my husband, he'll say it's always been that way. but but to me, it wasn't that bad. I felt like I could definitely do a lot more. But when my youngest was a toddler, that's when I started having the like it was very pronounced episodes that I could not ignore. And that's when it was a few years later actually I went to the doctor because I was like, if I go to the doctor now and I tell them what's happening with me, they're gonna think I'm crazy. So it wasn't until it was like affecting my everyday life that I was like, okay, I better go because I don't want it to get worse. But yeah, my pregnancies were um no, I guess normal. I did have some weird things happen when I was pregnant, like um, hallucination sort of stuff, like as I was waking up. But I think a lot of women with epilepsy, they find that their pregnancy actually they have less seizures. Was that the case
Yeah, I
with
read
you?
that. Mine were worse. They were more pronounced, but catamenial epilepsy has always been
Yeah.
on my chart, so not surprised there. But yeah, similar to what you said, I was surprised to hear that women, sometimes go into remission.
Mm-hmm. Yeah. And being that I didn't have tonic clonic, so I don't know, I can't speak on that, but yeah, and I wasn't having, but it seemed like after I had my son and I think I was still nursing him, that's when it came on. So,
Yeah, absolutely. So, in retrospect, anything you would have done differently?
if I knew that I was actively having seizures and I wanted to get pregnant,
Hmm.
mm, that's tough. I guess just like anything else, you want to try to make sure you keep your doctors involved before you start planning to
Right,
have a
right.
child.
To adjust the medications
Yeah,
and
to adjust the
prepare.
medications. Yeah.
That's what it sounded like. A new visitor tonight, her most prevalent concern was considering, she gave the story of being just married and considering starting a family, but she's doing all the planning now and asking the questions. And I'm thinking, I wonder, if I had done something like that, would I have known about carbatrol and the medications that I was on, doing anything? Thank God my daughter is, perfect. But uh, yeah, didn't do much research with my son either. Happy little quarantine baby, but should have gotten off of one of those benzos before getting pregnant. In retrospect,
Mm. But your seizures increased with your son when you were
both
pregnant.
pregnancies, yes, and they were actually 10 years apart. My children were 10 years apart, so I'm thinking here, the daughter's been joking around for years that I'm middle aged. As soon as I hit 30, you're in a different part of your life now. You're middle aged. So I don't know if maybe that's sunk in,
Well, if
but
you're
that's what
middle
I'm
age,
that's
I'm ancient.
that's what I'm saying. So I'm thinking now, son, I'm pregnant with son. I know when to expect the seizures. He comes around. Obviously, I'm stuck breastfeeding, so not, going back on any of those medications that I don't want to be. Trying to see the positive side here. I'm on less medications, letting this implant do what it's supposed to do, and actually got to look at my notes, realizing my seizures are not getting any worse. I'm getting off of these stronger medications because I don't want him to be exposed.
Yeah.
And throughout the pregnancy, yeah, I mean, it was kind of a blur at this point. I had more tonic-clonics than normal. It was always on that, third on that trimester. And when starting the breastfeeding, when it's all the same times as the first pregnancy. But when, once he was already born 2 years after, and now I'm still on a predictable schedule, but taking less medication, I'm convinced now that I probably could have been a little more proactive in that decade in between pregnancies of getting off of some of these other medications that I know do harm to you over time, especially when you're at the max dose. And that's just what the habit of a neurologist is. When if you're still having seizures at all, then if you can increase the dose, try it, do it. And I think I had to kind of set him down, get him to look me in the eye and explain that's not my game plan anymore. Now I have this RNS device. You have all the data that you need to analyze what's going on. I've only had this device active for 3 years now. And before I took myself off of the medication, I don't think they were doing much. I don't think they were really changing the settings much. I don't know if they're trying to save battery in this thing or what, but I had to get serious with the doctors about, I want this to be my primary treatment for seizures rather than medications, because the side effects and long-term effects on internal organs, I don't think are acceptable.
Yeah, they they took me off. At the time I was on, I don't know what it's called now. Is it called so it was called Zerantin. I think it has a different name now.
I'll look it up.
I was on Zerantin and Tegretol, and that's when they took me off of those when I was a teenager, because I was having like stomach aches, and they said that my liver, I was getting liver damage. So I'm glad that they did discontinue it. I wish I had known more about epilepsy. It really felt kind of like a mystery to me,
Yeah.
because I didn't know what was going on. I
Yeah,
just,
just take this medication and hope for the best.
yeah, right. I just knew that people were like, "Oh, are you okay?" I knew I couldn't like swim, I couldn't ride a bike, I couldn't get on roller coasters, you know, and like I was even in special education because I had difficulty because I was having so many absent seizures. I was in special education all the way up until 6th grade.
But that's impressive. Middle school, I mean, elementary school, you know better than anybody, being that you're, an English tutor. That's the most important years of getting the basics down.
Yeah,
So
yeah.
if
I
you
mean,
made
I'm
it out of
grateful
special
that,
education, that's
yeah,
like
right.
jumping to advanced. To me, that's what that sounds like, going from basic to advanced. If you made it into middle school, that's when the algebra starts.
Yeah, it was shocking. I remember telling my mom, I'm like, I want to be in a regular class, because the kids would make fun of you. They would see the special education class that had like 6 or 7 kids and at lunch, and they would kind of make fun of you. But I struggled. I struggled in school, and then finally I just was like, I got to get out of here. And I homeschooled the last few years of school because I was just overstimulated all the time. It was just too much for me. But
Yeah, I did too.
yeah.
I went to a special, I call it the special school for special kids, um, for mental health reasons. And then I was basically dropped out of high school because it was just too much.
Yeah. Yeah. I think we talked about that before, the neurodivergence. I think that was the reason why I had a hard time in school. But
Yeah, I feel the same way with my ADHD and my autism. I had a really hard time focusing and learning properly, and they don't cater to kids who need more. Um, and I was never allowed to be put into any other classes. My parents ignored it. So I finished high school with a 2.3 GPA, I think. It was really low.
You finished though.
I did,
You
thankfully,
did
at least.
finish. Yeah.
Yeah.
That's a victory.
There you
Yes.
go. That's exactly what you bring up
Because I
first. You
know
did
how
it.
stressful that is. I was like going to 10th grade and I was like, I can't do I think I did. I was like at the beginning of 10th grade and I was like, I can't do it.
Yeah,
Cannot
it's
stay
so
another
hard.
day here.
I wanted so badly to go into homeschool because I felt like it would have been so much easier to learn at my own pace, but
Hmm.
I wasn't given the option, so I pushed through. But yeah, I if I could do that over again, I'd do it differently.
Oh yeah. So Lufa, when you were in school, you said you were in the special classes, and did you actually finish high school?
No.
Is
Not
that a goal of yours?
uh eventually. Yeah.
Okay. So has your learning style, like, do you still read? Do you kind of know how you're going to tackle that?
Um, I don't know. I haven't really thought about it yet.
That's cool. I was just so surprised at figuring out how little reading daughter's even going to have to do to graduate. If it wasn't for like starting college classes, then a lot of surprisingly online learning she can still watch videos of essentially. So
Yeah,
there's a lot of different ways to learn now.
yeah. Hopefully it won't be something won't be that bad. But
So another post here, somebody saying my partner is understanding, but he doesn't understand. He'll listen to me cry about my TLE symptoms for days, and although he's extremely sympathetic, he just doesn't quite get it. He explains things away and feels that my symptoms, memory loss, and mood swings are relatable human experiences. I know that everyone occasionally he lapses in memory and or has lapses in memory and mood swings, but I also see the patterns and correlations between my seizures and side effects. I want to be able to vent about these things and have to them to be dismissed as something common. Curious about how other people deal with them and if it's ever going to get better. Feel like a broken record with him, and I'm sick of being told that my experience is not any different than anyone else's, because I know that it is. Sick of feeling alone.
I will say that I have experienced this with my husband, um, and with other family members as well, is that when I try to talk about my symptoms, um, it's usually minimized. And like just recently, the biggest one for me was that one day, deep in an aura with a headache, um, I was telling him that I felt really strange and that I thought it was weird that I had memories flooding back into me that I didn't feel like I knew about. And he was like, "Oh, that happens to everyone all the time." And then I was like, "Well, I don't remember my childhood." And he was like, "Well, nobody remembers their childhood." And I was just like, "Okay, well, that's not what I'm trying to get across, but it's difficult to explain it to people who don't understand." And that's why I like being here because it's nice to be able to talk about the things that we're experiencing and ask questions and stuff and actually get, supportive answers and advice and support in general. Whereas with family members who, have, I guess, their own things to deal with most of the time, they don't they don't have as much space to give to you to be able to talk about what you're feeling and how it can be shitty most of the time.
Yeah, I was wondering, do you think that sometimes people, well, two things. Maybe they think that you are going to think yourself into a seizure. So they're like trying to minimize it, like, oh, don't make a big deal out of it because then you might have a seizure.
Oh, I totally feel like that. And it's even directly said to me sometimes too, like, "Oh, I'm so sorry for stressing you out," and "Oh, I didn't want to bring this up to you," or "We don't need to talk about that because that's too much." And it's like, I think I can tell for myself what's too much for me, and I don't need everybody to be, fearful of causing a seizure because that's not, I mean, one of my triggers is not stress. I know it is for some people, but for me personally, it's just not. And so it's kind of hard to hear that because I'm like, okay, then I guess you haven't been listening to me because I've already told you this multiple times. It's not something for me.
Yeah. So what are your triggers?
Personally, so far, from what I've noticed, is THC is a trigger for me. It's also a trigger for my endometriosis. It causes flare-ups. So it makes me very ill. High altitude, or just in general, honestly, moving altitude from going high up to super low. I have to travel to go see my neurologist, so that drive down, and the car sickness, like the vertigo that I get from being in the car, is a trigger for me. Too much sugar, like if I have too much sweets or like soda or something like that, that can make me have a seizure. Um, a lot of it has to do with my equilibrium though. So like yesterday with the new glasses, it's like, for people with glasses, there's always a transition period,
Mm.
changing between the lenses. But um I guess now for me it's like too much for my brain to handle, so it just like spiraled me out of control very quickly. But what are your triggers?
It's similar. I do get the altitude thing, and also the worst is the storms. If there's a storm that's like out, miles from us, and like the storm is gonna come later on that evening, I'm just in bad shape. Like I can't even hardly talk.
You can feel the pressure changing.
I can feel it. Yeah, it's like someone
Yeah.
is pressing on my head. Also, this is a weird thing. I used to wear my hair up, but that would trigger seizures. Just
Ah,
that pressure on my scalp. So I wound up cutting my hair because I'm like, I can't put my hair up.
because
And
it
my
causes too
hair,
much
yeah,
pressure.
yeah. So
Yeah.
I was like, I'm just gonna cut it so it can always be predictable, and that way I'll know what to do with it.
That's
But
why I
yeah.
like to stick with the braids. It doesn't pull as much.
Yeah.
And as far as I'm concerned, that's the signature look now. I love it.
Yep,
That's my
every
signature.
time.
Yeah.
Absolutely.
Yeah, I like those. Yeah.
Thank
Even
you.
braids sometimes at night if I try to braid my hair, so look presentable the next day. I have to be careful not to get too close to my scalp.
Yeah, you gotta leave a little bit of room and
Yeah.
like keep it loose.
I am really
So, Nikki, that
sensitive to
sensitivity
pressure.
to pressure, what about hairnets or hats or any accessories?
Yeah, the same thing hats. I have to be careful. I'll
Oh,
start getting like dizzy and nauseous, and I'm like, what happened to my head? I don't know. But
okay.
it's
So doing
really,
any,
really sensitive.
handstands or toe touches and stuff like that is really pushing it.
No, yeah, yeah, yeah. Can't do any of that. Now it's funny because they had me like in kid gymnastics when I was younger. I could do that, but as I get older, I get more and more sensitive.
Sensitive. Yeah.
Yeah.
Well, on that note, this is one I've been saving for ladies' sex. So, Lufa, get ready to contribute. This one starts off as so female. I've been on Lamictal for a few months now, and literally since about a week into it, my orgasms changed. Basically, they last for a long time and don't stop until I stop whatever it is I'm doing. There's a build up and then you hit peak. Usually it just sort of peaks and then goes out in waves. Then it's done. This way, I hit the peak and the waves go out and just don't stop. It's like waiting for the beat to drop. It just never does until my hands get tired. If I'm using a toy, I'll literally go until the battery dies. Is this normal? Seems kind of freaky. Really not that I'm complaining. Also, way more horny than I've ever been. Anybody else have a perspective on that?
Why
Lamictal.
That
She's talking
particularly
Lamictal.
say for me to contribute to this?
Come on, you're like the only young single one around here. Oh shit, I'm single now. Okay. Go.
I don't do all that.
I'm
Like, I kind of just sit back and relax and watch true crime stuff and whatnot. I don't
And when
know.
those doctors solve a cold, I mean, those detectives solve a cold case, that's exciting. Come on, talk to me. Any medications ever affected
I mean, they make me
unexpected?
not
So it does the opposite for you. You're saying it
excited.
kills the
Yeah,
libido. Okay.
I don't get I don't get that long. Like, I don't know what. I don't really.
That sounds like it could be inconvenient at times.
I mean, my best advice would just be to not do it if it's causing a problem. But if it's not causing a problem, do your thing. I'm not judging you.
There we go.
Judgment free. Do your
There
thing.
you go.
It could be like a medication thing, maybe like heightening
She
it
did mention
versus
2 weeks
then.
into Lamictal.
Yeah, that I've gotten a message DM one time on Reddit from somebody asking me it if the Keppra ever raised my libido, and it was a little weird because I'd never spoken to this person before, but I was just like, I haven't experienced that, but if you are, then I would talk to your doctor. But yeah, I mean, I think that can be a thing. It's different for each person. It affects everybody differently. So it could be what's going on here, but then again, I've never experienced that. Although I have experienced seizures during and after. So yeah.
Well, I mean, what effect did that have? Like for me, if I had a seizure before, like during or after, all memory would be gone.
Yeah, I mean, that's usually how it is. Like, the 5 minutes in, and I'm like starting to lose it. And then he's like, oh shit. And then everything stops, and I have to lay down. And then I'm out for the count for a while. And then he wakes up and he's like, are you good? I don't know if I ever want to do that again.
How do you hold back from just telling him, I got to do all the cleanup and I didn't even get that, I don't remember.
Yeah, like
you know, that's a little one-sided there, but
it is.
always got to understand from their perspective too.
Well, and he's been through a lot. He had to go 6 months one time. So, yeah, I try to respect his opinion.
That's the best way to look at it. So you get like wife of the year at this point. What do you think about
Yep.
that, Nikki?
I don't know what to say about that. I don't have any expertise on what the poster um, was saying. I think, definitely having any kind of disability is going to affect your entire life. So I think that, yeah, I don't have anything to say about it. I don't know.
Honestly, I started taking notes for this visit a long time ago, and I think what triggered that was because, or what prompted me to write this one down is because this was when I was 2 weeks, July 6th, off the clobazam entirely, and I didn't expect changes like this. Okay, but this was an increase, the opposite. Everything I've always heard is like, a decrease. You don't want it anymore. I'm 8 months out of this relationship, and yeah, I had bad thoughts sometimes where like, am I ever actually just going to forget what it is? Because it's going on a long time now. And this week, like, it looks like I wrote down that I came really close to asking a friend for, a favor essentially, because I was just so stressing about how I might just, forget what sex is entirely, what it feels like and whatever. But I think there is a lot of downplay on how getting off of the medications actually, going on a new treatment plan, especially if your doctors don't necessarily order it, might affect your mental health and well-being. Because Lord knows I don't do that kind of thing. I don't even know how to find porn if I wanted to, but I came close to asking a friend for something, and that's not that's way out of character for me. I was just so scared, I guess, of these different feelings going on now that I'm off of the medication. It's not what I expected. When unexpected things happen because of these medications and these treatments, you can definitely do some unexpected things. Anybody else relate?
I'm wondering if that could be a seizure in itself.
It did feel anxiety, but why would I be wet when I'm thinking it? That doesn't.
Well, it's kind of like there was a question yesterday that we talked about on Family Day. I don't know if you were there for it, but Pookie asked
I was in
about
and out.
it was a guy talking about how he was thinking that the masturbation that he was doing had something to do with the amount of seizures that he was having, or if they were causing the seizures to happen because he was doing it, or if he was having a seizure and doing it in the seizure, which was a confusing one, and we didn't get very many answers out of it. But I mean, there's so much stuff out there with the medications that we still don't understand. So there are things like that can pop up that are kind of scary, like we're saying. Like, it's scary that you went so far to do that. But it's like stuff, all of this is out of our control. We're guinea pigs in testing right now, and all these medications are things that they don't tell us all the details about. And then even with the seizures, like you don't know what's happening inside of there. You can't see it. So, new things could start happening out of nowhere. Like for me, for example, I had a laugh attack seizure, and I've never had that before. And that was like really weird. And my husband was laughing his ass off when it happened because he was like, "Why is she laughing so hard?" And I was dying, like literally could not breathe. And he was like so confused. He was trying to keep straight face. But, watching someone laugh hysterically so loud and disturbing like that is definitely strange. So there can be some strange seizures.
Thank
Yeah,
you.
the way I think about it is like the brain, anything that, any action that we take, the brain is controlling it, like actions, feelings, sensations. And if the seizure can occur in that part of the brain, then it can create that kind of behavior. Like years ago, my mom had a friend who had seizures that made her kiss people like on their arm. So I think it was a kind of complex partial seizure because she wasn't aware of it. But she would kiss people up and down their arm, and of course she got in trouble a lot with this kind of behavior. But just any behavior that you can think of, a seizure can cause it if it occurs in that part of the brain.
So if
Yeah, that
anything,
makes a lot of
that's an
sense.
important thing to pay attention to.
Yeah, it is. And that's why it's good to take notes about anything that you feel is off. Because we know ourselves the best. And we know when we're not feeling like our normal selves. And so anything out of character for us is good enough to write down and keep track of.
And in combination, there's the memory loss there too. So I don't truly know myself 10 years ago. I couldn't tell you what my day to day was before, you know, before a second, before a son, really. I don't really remember what I was doing going to school and working and with a 3-year-old. He had the CDL, so he was out of the, gone all the time. I had a camera, but nobody lived with us.
Hmm.
And that went on for a good 7 years. So I don't remember how or why. Like, we were in DC. How the hell did I not get shot? I don't know. But here's a funny one. Nurse yelled at my husband. Hi guys, buckle up. We had this one nurse at our hospital that has been rude to us since we moved here. She said many times that I am too young to have had a heart attack, along with a bunch of other BS. Anyway, that's not the point. My husband is my biggest supporter, caretaker, best friend. He does everything for me. We went to the ER a couple days ago because I had a seizure and hit my head. It's important to note that I already had a concussion due to this exact thing happening a few days ago. It's important to note that my husband is a bomb tech and was on emergency response all day, dealing with people being dumbasses, and wasn't able to pick up a refill of my seizure meds. I still had some, so it wasn't a big deal at all. At the ER, I wasn't coherent at all, and to be honest, my memory is a little spotty, but I remember being at remember the basis and then his retelling. So we're there and I'm loopy. I go in for a CT scan and we're excited because we haven't seen her, but I come back to the room and she walks in. She doesn't say hi or anything to us, but that's fine. Instead, she turns to my husband and starts literally screaming that it's his fault I'm here at the ER and that it would have picked up if he would have picked up my prescription, I would have been completely fine. He tries to explain the situation while reiterating that we have extra Keppra, but she starts yelling again, saying if he would care, we wouldn't be there. Then she makes him call his chain of command. He's in the army, so it's like 1 a.m. at this point, in front of her, and tells him to tell them that he needs to pick up the prescription tomorrow. They know us very well and we're all friendly, thank God. But they were like, if you're on call, our hands are tied, but my wife can pick it up for her and bring it over if that's the case. This answer didn't appease her, and she tells Thor, I'm guessing her husband's name is Thor, that he has to go tomorrow, and if he doesn't, she's going to report him for some caretaking thing. We did end up getting the prescription the next day, but he was so upset and felt awful about himself, even though he didn't do anything wrong. Could you imagine a medical professional calling out spouse in the army? You have to call chain of command in front of me. Where in the world did this happen?
What kind of power trip was she on?
Yeah, that nurse must have been mouse. I just said that
She
nurse must have
sounds
been
like
like
she was having
stimming
a bad
something.
day.
Oh yeah.
It sounds like that was her personal stuff that was coming out.
Yeah, that can
Yeah.
happen sometimes.
Especially when the circumstances are there to make it look like, patient probably mentioned, oh, I didn't get my prescription today, or maybe patient didn't mention it at all, and nurse just happened to notice on the chart on an army base. I'm thinking maybe all the paper, all the medical data is together, so maybe nurse could have seen that she was due for a prescription pickup, didn't happen, and maybe that was her just kind of putting two and two together before necessarily asking the patient about it. So yeah, I'm thinking she probably jumped the gun on that one, but I can understand why that might get frustrating if you think you see a situation that could have been prevented.
That is super inappropriate to do as a professional. That is so inappropriate. That's just inappropriate. So I don't know.
Yeah, I mean, especially somebody in the army, you can't really do much. You're at the will of the government at that point.
Telling them to call chain of command in front of her, that's a part where I thought it crossed the line.
Yeah, and if he's in the army, I'm guessing that they live near a military base, and so maybe her husband is also in the army. I mean, she was mad at him.
That's true.
Could
That's
be.
true. Must have felt like a familiar situation.
Uh-huh.
There is a lot of stuff like that too within the army with husbands and wives and marital issues, couple issues.
Oh yeah, yeah. I live
I'm
around all of
sure
it.
she could, yeah,
Oh
I'm sure
yeah,
she could
any CDL
probably see
drivers?
some stuff.
Yeah. We live near a base, and yeah, that's true. A lot of family problems around
Yeah.
here.
Shame. But all in honor, this person is saying they're writing something about post seizure pain. Sounds like they want some answers. I had a seizure in my sleep the other night slash morning. I woke up completely disoriented with no sense of what day it was and some temporary amnesia. In the ER, they referred me to get an MRI done, which trying to schedule has been a nightmare for the last few days, and sent me home feeling like absolute garbage, and that has only gotten worse. My lower back is killing me. I managed to get some muscle relaxers from my primary doctor, but those haven't seemed to help much. I could barely get out of bed this morning, stiff, but with sharp pain if I turn or bend any sort of way. Is there anyone who has experienced this that might be able to suggest something useful? I've tried heat pad, biofreeze, Tylenol combination these past 3 days, and it's just not cutting it. So lower back is killing me is what this one was she saying.
I have injured my, what is the bone on uh the lowest part of your back, like right on your butt?
Toxic?
The
Mm.
Yeah, I've injured that from a seizure, and it hurt for like 2 weeks straight. And nothing was helping. And I probably should have gone to the doctor, but I just, the brain. But yeah, I mean that could be an injury that happened. And they might not have realized it at the time. But I would definitely suggest getting like a second opinion to check that out, because if nothing is helping it, and it's that uncomfortable, then yeah, you gotta get a second opinion. Also, I'll be right back.
Yeah, that makes sense. So some of these seizure injuries really do. If I can't see that something is not like a compound fracture or bleeding too much, then I'm more likely to just try to fix it at home. And sometimes it takes some weeks, unexpected. How do you handle your worst soreness and injuries, Lufa? Warm bath and heat pads or anything not typical?
How do you handle your what?
Your worst injuries. You know how like the being sore after a seizure is a totally different kind of sore? Do you
Uh,
have any suggestions for maybe other
sleep,
people?
darkness. So during sleep, darkness. I hate being in the ER. That is the worst place to recover from a seizure.
Just all the commotion and light.
Mm-hmm.
Yeah, that makes sense. So did anybody come with questions today or something you wanted to bring up to other ladies?
Yeah, I guess I was wondering, does anyone else have a catamenial like pattern with their seizures? Is it worse before your period or ovulation?
Go ahead, Lufa. Didn't you say you were catamenial too, Lufa?
Yeah, I don't know. I would assume so, but I don't know. I have no idea.
On mine, the health app on the Apple phone, I keep the meds and the cycle on there, and it's this useful reminder that it tells me 3 days before the cycle starts that be advised it might happen within the next few days. That's typically when the seizure happens,
Mm.
Yeah.
and then record the data as it goes. It just asks for if it's on, and then heavy, light, or medium, and upon the last day, usually when symptoms stop, for some reason I wasn't putting two and two together for a long time until I started actually writing the stuff down. Before iPhones were a thing, it did take writing it down on a calendar, circling days in different colors to
Yeah.
tell that these things did actually happen on the same day or within 24 hours. And that's what it took for me, because when puberty started for me, it was never regular, never predictable. But I was a lot more active. I probably didn't drink enough, and I always just listen to the doctor's advice of live healthier and you'll be regular, or maybe it will stop for a little bit, and that doesn't mean there's anything wrong with you. The doctor never associated irregular menstrual cycles as a cause of concern at all.
Wow.
Yeah,
Hmm. That's concerning that they didn't even think it was a concern. Yeah.
that was going on for a couple years before the first seizure.
Wow. Yeah, I'm sure that probably contributed to it in some way. Like,
I think it might have had something to do with going
yeah.
to that real strict little Catholic girls' school up in New Jersey here too.
Uh-oh.
Yeah, it's a little bit of a taboo. Don't talk to me about that kind of thing. And parents had to both work full time a lot. The cost of living up here has always been ridiculous.
Oh
Glad
yeah.
this is a vacation.
Yeah, yeah. I we might want to move there one day.
Oh
But
yeah, you took a look up here in the tri-state area.
yeah, I was raised in, I mean, I'm from New York, but yeah,
Oh, we
I'd
could see
like
New
to.
York from here. We're over in Wayne now.
Oh, okay. I know where that is. Yeah.
Yep, yep.
That's
Oh, I
not
say I
far.
see what the tax dollars are paid for.
We want to move to Hewitt, the Green Lake area. It's so
Yes.
beautiful.
Oh,
Yeah,
it is
that's not
gorgeous
far
out
from
there.
where you are.
But I noticed it's 1,000 square feet for $4,000 a month rent.
Yes, it's crazy. It's insane. Right
Yeah.
now, it's just a dream.
Oh yeah,
It's a
that's
very
what I wrote it
elaborate
off as.
dream.
Yeah, I don't know if you noticed the chat in EU on Reddit. People are throwing out there a lot of ideas to, maybe plan an event, some kind of get together in 26. And I just put it out there to let's talk location. The priority for a lot of people is, choose a state that is, where THC is 100% legal. And New Jersey is one of those states. Somebody who lives in Philadelphia suggested New Jersey as one of them, and there was an overwhelming response of nobody likes New Jersey. Don't get your head out of the clouds.
You know
Yeah,
what, though? When growing up in New York, I did not like New Jersey because the only thing I knew about New Jersey was Newark and like
Patterson,
Teaneck and places
Trenton,
like that.
yes,
Yeah.
yes.
It wasn't until the past few years we were visiting Jersey because my dad is from Jersey and he's in the VA hospital. He's dying, but we go and see him, and when we go see him, we stay in Hewitt. So that
That
made me
that is a
see a
getaway to look
different
forward
part of
to.
New Jersey.
Oh yeah, different
Yeah.
world. So you see the tax dollars at work. How I was talking about it, just like better roads. There's a
Yeah,
public
I know.
park on every corner, and
As
they
soon
are
as
nice.
you drive over to the New York side, the roads get worse.
Literally on the bridge, you feel like it starts sweating. Yes,
Yeah, 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 yeah.
yes.
And you know how New Yorkers and New Jerseyers are, like they don't
Oh, always,
they
always.
have their beef with each other, but
Oh yeah, fucking Jersey and hate New York. Yeah.
yep, yep. But now I kind of see it. I'm like, wow, I can get the same food in New Jersey and it's better roads and it's prettier. But there's
Oh
there's
my,
parts of New York that are really nice too. But
but my mother will not leave until we go to a diner. We have to take our entire family to a diner,
yeah,
and little buddy's not always the best at restaurants, but she is convinced that
wow.
something about a genuine Jersey diner will settle him down.
Wow.
We'll see.
We
Luca,
like
what were
we
you saying
got
about the
bagels the last time we were there.
yeah,
not the
there's some good bagel spots. Not Starbucks, that's for sure. Yeah, Luffy, you started saying something when we were talking about possible location for a meetup event thing.
Oh, I just like New Jersey.
Oh, there you go. As
Good
long as
bake,
the good memories are there.
good pastries,
There you go.
good pasta, good food.
Mm-hmm. Yeah. And I can't eat
I
the
don't,
regular stuff. I have to eat gluten free, but they even have that.
yeah, and I don't wanna go anywhere hot because that makes me,
Does that trigger like dehydration, or it's just heat in general? even if you know you're drinking enough?
It I've just always been like I don't know, like I get triggered by I don't know, the heat just totally wipes me out.
Me too.
And with like the sun totally wipes me out. I get sun poisoning a lot, or like uh yeah, I get sun poisoning, like sick.
That's what I was surprised about up here. I mean, it feels better in the morning for sure. When the sun comes up in Florida, you can't. I don't want to go outside after 5 minutes. But up here, it was 7:30, and I took the dog for a walk with a hoodie on, and didn't have to shower when I came back.
I'm so jealous.
That's incredible. That is incredible, and it's a big difference in the feeling and not that big of a difference in elevation. I really thought we were going to be like in the mountains up here, but it's only 600. It's only 600 feet elevation.
Really?
And the Smoky Mountains, when we were at 1,500 feet,
Oh wow, yeah.
that brought it on.
That
It's
brought it
like,
on. Yeah, now I did
I,
have a hard
yeah,
time when I was there. We were there last month, and my ears that's the military base. My ears were popping
okay.
um when we were there the last time. But I
Hmm.
did pretty well with seizures because I thought I figured out the cause of my seizures because I have so many allergies. So I started taking an antihistamine, and I did pretty well that week that we were there. But then when I got back, I got worse. And I was like, what is going on? Then I figured out, oh, it's the antihistamine. It lowers the seizure threshold.
Oh, okay. And that's one of those little side effects they don't mention.
Yeah. So now I can't. It's one of those catch-22s. It's like the allergies are probably exacerbating the seizures. So you take an
Hmm.
antihistamine, but the antihistamine also does that.
Yeah. So talk another risk versus reward
Uh-huh.
that
Yeah.
they failed to mention.
Yeah. No,
I was. Mhm.
I started taking that on my own, and I like added a bunch of supplements. I'm still taking the supplements, but I stopped taking the antihistamine.
Hmm.
But that was
So
a
in
great
stopping to
week.
take the antihistamine, was that one of those? I mean, do antihistamines form that kind of dependence where if you stop at cold turkey, or did you have to wean off of it?
No, I don't think that one does. It's
Okay, okay.
like cetirizine, or I guess that would be what is it called? Zyrtec.
Oh, okay. Yeah,
I
I've
don't
heard of
think
that
it
one
does.
before.
Yeah, it was a very low dose, but it really helped a lot. I mean, I think that's why I was feeling so good. Not only was I not having hardly any seizures, but I also had really my energy was higher, which
That's the part I like better.
yeah, I'm always just so tired and lethargic, and I'm like a sloth, a human sloth, pretty
And that's the
much. Yeah.
thing with how your memory is. Sometimes if that's the new you, essentially, you don't notice until it's different. Did that ever
Mm-hmm.
happen with you, Lufa, where they changed your meds or switched you off of one onto another, and for that little break in between, when you were off of one and not, up dosed on the second one, you actually felt better, more energy or anything? That's how I remember it, coming off of one of the Ficampas or the Briviac, like one of those benzos that really had me feeling bad. I
Well,
forgot.
when I was on like medication for, because I've always been on like a lot of antidepressants and anti-anxiety or antipsychotics. Um, all those little fun guys. Uh, I am naturally have bipolar 1, so I'm up and down. And most of those meds like just didn't work for me at all. So I never really got to experience them. And I've always just been bipolar.
Did they always just have you on that low dose, that lowest dose? You didn't notice an improvement, so they stopped you?
They just kept trying different medications over and over again.
Oh, okay. Well, at
Uh,
least that's a little more reassuring. I'm happy they didn't tell you take more, take more, take more
I
until
mean,
you're at
they
the
did,
max dose, and then, oh, okay. Yeah,
they
that's
did.
that cycle.
But they would also, I've also been on like probably over 100 different medications. But they kept me on one of them that gave me a really bad side effect for 4 years. I don't know why. But right now, the Breviact makes me really tired. And I heard that can be a side effect. So I'm on a stimulant and it makes me tired. But I'm also anemic, so
Yeah, that's definitely a hard cycle to get through. So in taking your notes though, does your doctor actually, you feel like they're on the same page with you? Because you probably have a couple different specialists, right?
no, I just have my psychiatrist, my
Oh, okay.
therapist, and my uh, seizure specialist.
And they're
Uh,
just saying, even if this med, you don't feel as happy or active, it's still controlling better.
the Breviact is not controlling the seizures as much, but
Is that one for
I
absence
mean,
seizures?
what?
And is that one of those ones they give you for partials? The focal seizures?
They give it to me for the generalized
Oh, okay.
seizures because when I was in the when I was in the hospital, I asked him like where in my brain is the seizures, and he's like your entire brain, and I was like, oh, lol, that's funny. So sorry. So hold on. So wait, what were we talking about?
Weaning off of, you said you were having the seizures because the Briviact wasn't controlling your generalized seizures.
Oh yeah, the Briviact is for to control my generalized seizures. Um, the capra's still coming down. The reach is still there. Tony, you get fed. Um, it is still coming down. I still have capra rage every now and then, but I'm able to control it. Um, the depression is still there for sure. But the Briviac just makes me like tired. I feel like it doesn't really work as long. I'm on a low dose, but it makes me like really tired. So, I don't know.
Do any of the medical professionals say, we'll try this one more dose and then make a change? That's what I
Well,
used to appreciate when the doctors would
mostly
kind of tell me a plan.
my neurologist or yeah, seizure specialist who are gonna go down. He's in Chicago, so we're gonna go down there.
Oh, okay. So is this one like an epileptologist?
Yeah, he's the university. I have a really good care team. So
Nice.
I think they'll take it seriously. I want to see if I can get a MRI or like I don't know, like a scan of my brain.
to get like an actual picture look.
Just what? Okay, sorry, my cat is hungry.
Kitty's still in the show.
Yeah, he's hungry. He's to eat. I want to get a MRI or something of my brain just so that we can see what it looks like, because I don't think we've done that, and I think it would be beneficial in my opinion. Yeah. Even though my brain is still developing.
Yeah, that's
I
true.
know that. I admit that. But it doesn't hurt to take a look.
I'm surprised they haven't taken an image. That is surprising. Yeah. Well, hopefully that'll result in something.
They
This
might.
person has a question too. What do you say?
I don't know. I don't think they have.
Yeah, no, at this point the MRI is not an option for me anymore. Once you get the implant, you can't go in that big magnet or else I guess it'll like rip it out of my head. But the they're trying to say that there was plenty of pictures taken before. So that was enough to know there's nothing there. We'll see. Time will tell. This person has a question saying, why do I only have seizures around other people? This is by no means a complaint. Having a grand mal seizure all alone sounds like a nightmare. But I find it curious that having suffered from seizures, focal, tonic, and occasional tonic-clonic for 10 years now, I've never had a tonic or tonic-clonic seizure alone. There always been a person with me, thank God. I've had many focal and absent seizures alone, but not a full-blown knocked unconscious experience. For reference, I've probably had 40 to 50 tonic seizures in the past decade. Could this simply mean people are a trigger for me? I love people and I love being around others, but I also have autism. Social communicative interactions can be difficult, to say the least. So it could make sense. Does anyone else have or relate to this experience? Well, sounds like they just discovered their own, a trigger.
Yeah. Being overstimulated by people. That makes sense.
Yeah, because what they're saying too about a tonic having a tonic seizure but not tonic clonic. Tonic seizures can still, I mean, you still get injuries. I think tonic is the part, where you lock up, you get all like tense essentially.
Yeah.
So you can't stay standing during a tonic, from what I understand. But hey, I would want to know if it's always in the same place. If you have some kind of routine, and right when you stop at that corner store is where those seizures have happened. It could be anything. If they're happening in the same place, a scent, or I know the gas stations sometimes smell really strong to me, and I might get dizzy before I realize it.
Yeah, I don't like that smell either.
Yeah.
Yeah. I think
So that could be
you
it.
hit it right on the head. They discovered their trigger.
Exactly what it sounds like.
Recently, all I can taste is like metal in my mouth.
For how long?
It's been like 2 weeks.
Wow.
And it hasn't gotten rinsed away or washed away, or like even after brushing your teeth, you don't just taste the Listerine or something.
It still tastes like metal. It tastes like metallic-y.
Yeah, you definitely want to talk to your doctor about that, because
I
that can be an
don't know
aura.
what that is though. That just came on suddenly, so I don't know what that is.
Yeah, mention it to your doctor. I get the metal taste too, but like I was saying earlier with the storms, like that's part of the symptoms I get a metal taste, and I have problems with speaking, and I get all the other things. But a metallic taste can be like an aura, or it could be something else. But yeah, it's definitely, that's a long time to have a metallic taste.
Yeah, I don't know. It just kind of always tastes metallic-y.
Yeah, like you have a penny in your mouth.
Yeah, and
Yeah.
I eat, but like at the at the core of everything is like that metallic-y weird taste. And I'm like,
Mm-hmm. Now you did say you're anemic too,
yeah,
so
I
it could also
rec-
be that. Yeah.
yeah, recently my anemia has been really bad. I've been like feeling really weak. I'm getting a lot of bruises.
Mm-hmm. Oh wow. Yeah, I'm anemic too. I can't seem to get out of being anemic.
Yeah, that's no fun. And I
No.
don't really know what to like do about it because it's just
Well, it sounds like it might just be a blood test, iron deficiency.
Mm-hmm.
Is
been
that the source of your anemia?
it's always up and down
So you
all
just don't feel
the
like it's bothering you enough yet?
time.
Well, at least you know what to ask for. Letting them know exactly what's wrong, what you got, and hopefully they do what you
Yeah.
expect. This one now sounds frustrating. Somebody saying medication withheld by a neuro. I had a 72-hour EEG back in April 24. I was absolutely miserable the whole time, ended up with scarring on my forehead from the nodes, and my insurance covered nothing. They adjusted the bill by 20,000, but I still had to pay 3. The best part is they didn't even find anything. I have been nervous to schedule a second long EEG due to these reasons. My neurologist has been calling to try and schedule a second one. I was about to run out of medication and the neuro declined my pharmacy's refill request. So I called the office to try and get a telehealth appointment to get the prescription. Live in a rural town, office is over an hour away. I was told they would prescribe me enough to get to my 72-hour EEG and made me schedule the test. Around an hour later, I got a call from my neurologist who is now claiming they will not continue to prescribe me my medication if I don't complete the study. Does anyone else have a neurologist that requires yearly 72-hour EEGs? I can't help but feel like I'm being forced to complete this highly expensive study that will probably not show anything just so they can bill me. That just screams that's the business to me. That's how it works.
I didn't know that there's a required. I did not know that.
Oh, I doubt the doctor's required to, operate like that to keep their license or anything, but
I didn't know.
depending on the
I
practice,
mean, I didn't know they require like a test every 72-hour test every what year?
yeah, they're saying that this neurologist requires a yearly 72-hour EEG. That's an inpatient thing. That's, I mean, you heard they got billed over 20
That's
grand.
long. That's expensive.
And that's definitely not a requirement for a lot of neurologists, a lot of doctors out there.
No, that's also usually hard to get. Is one of those.
Already saying
It's
they live an
like a
hour
week
away, so
long study, and those are hard to get. The only reason I got that was because what?
what I remember about the EEGs too, those inpatient ones, is that I was always told to try and have a seizure. So I would be not eating, drinking a one bottle of water in the day before I went, and setting myself up to not take that last dose and try to have a seizure in the hospital. So those inpatient ones can be really annoying because there's a lot of pressure to have a seizure. So that can be why a lot of people in the comments are suggesting that this might be illegal. Withholding the medication, they're saying that sounds like it's violating something.
So what I missed something. I stepped away. So
Mhm.
the doctor is saying they won't give them medication until they get a EEG.
Right. This patient had a 72-hour EEG, got billed $20,000. Their insurance didn't cover it essentially.
Mm.
And then they're on their last refill. They're living in a rural area, can't get to the office. So they put in a call to get the refill. And the doctor said, we'll give you enough medication just to last you long enough to get to the hospital to do this inpatient EEG, the 72-hour EEG. So they're literally withholding the medication, saying you don't get the refills until you complete the study. And
But they already paid for the EEG. or they
Not
didn't.
EEGs, right. I think that's another thing that's stressing this patient out is that they're not mentioning anything about the billing. So it sounds like they're still in the same cycle because when they posted this, they said it was it was last April. So April, it's been over a year since they got hit with that last bill. If they're stressing about getting this done and it's been over a year, then maybe that's why they think that just the same thing is going to happen again. If they got billed for the last one, even though it's been over a year, not a different policy, they're probably going to get billed for this one too. But apparently, this doctor is saying it's required to get their meds.
That's crazy.
Yeah, that's what a lot of the comments are saying too. What were you saying, Luca?
I don't remember.
Yeah, it sounds like a lot of people just agreed with that being unreasonable to say the least.
Yeah, I know my
But not
doctor,
not
he
all
would
doctors
not
have to operate
increase
like
it.
that.
Yeah. He
I
wouldn't
mean,
increase
they
it, but he did. I mean, he did let me have my medicine.
they didn't let
But
me
he,
have my. I have. Oh, I'm sorry.
oh, go ahead.
No, you're fine. Go ahead.
No, I was done. I just was saying
Okay.
my doctor wouldn't increase my medicine until I had another EEG. But he did let me have my medicine. He didn't like withhold the medicine.
Yeah, I had to basically like fight to stay on the Klonopin just because nothing was coming up on the EEG. But at one point they had me on 0.5, and I would have to cut that in half and have
Just to make it last.
5 once a day,
Okay.
which did nothing. Honey, what?
And here's somebody else just looking for support. It looks like they're saying spitefully quitting nicotine. The time has finally come. I'm getting on my own health insurance through work, and I saw tobacco attestation, $25 extra a month for being a smoker. I think not. So I'm ready to quit vaping. I've recently gotten medicated on Keppra and diagnosed with epilepsy after 3 tonic-clonic seizures in 5 years. It's been a long road with getting diagnosed, so I won't go into it. I've been vaping for about a year, and honestly, it's kind of lame, expensive, and I hate it when the vape juice touches my lip. Yup, big yuck. I'm nervous to go cold turkey because seizures, obviously. So I'm chewing the gum, and it's gross, but it needs to be done. I'm in therapy to deal
Honey,
with the hard
the
emotions that
fuck
got me
out.
vaping to begin with. It's
Oh,
not
I'm
an
sorry.
overnight fix, but we've made some progress. Anyone have any issues with the gum? Any tips? I'm determined not to pay extra for the health insurance because I'm being dumb with my health and money. Also, my husband has been vaping for a while, so if anyone has any tips on quitting while their partner, roommate, or friends or not, please share. Anybody ever had to get off of nicotine?
Sorry for yelling.
Always entertaining.
That my cat ate food, so he's happy run.
Oh,
Um,
shows you the joy.
I quit nicotine and I did it cold turkey. Sorry.
Nice. No, that sounds hard.
It yeah, well, I still smoke weed. So,
Okay.
but nicotine makes me feel sick. It makes my seizure threshold lower. I don't like it, and it's been one of the best things that I've got like cut out of my life. So from one prior nicotine addict to another,
It'll be worth it.
it's the best thing because it like genuinely I feel so much like healthier without it.
That's
Like
better.
it feels yucky in me.
Yeah, that sounds better. So overall, then, when you wanted the cigarette, was there physical symptoms that actually wouldn't come on? Was the headache not as bad without nicotine if you rolled one or packed a bowl?
If I what?
If you packed a bowl or rolled one, you said you kept smoking weed, so I was wondering if it was actually easier to get off the cigarettes with a joint instead.
I like joints. I used to smoke like blunts, but the wraps kind of give me a headache. So I like joints. I like bongs, but I just like weed. regular. But I don't really like cigarettes or vapes.
Hey, at least you did it. So you quit the nicotine and didn't go back.
Yeah. I still
Good
smoke the
job.
THC vapes, but that's
All right,
it.
so on this one now, this is probably something we used to think about. Hey guys, hoping to find others who might understand. About a year ago, I had my first ever seizure. Some might recall my previous post for more. Okay. But before it, I had jolting movements causing confusion and involuntary actions. These worsened, leading to my left temporal lobe epilepsy focal diagnosis, though it wasn't definitive. I'm 20 and still no driver's license. It's tough, especially with my parents and other constantly shaming me about it, making me feel even worse. Even after just one seizure, I'm genuinely hesitant to drive. I'm on Devalproex and lacosamide, working with my neurologist on dosage. I still have moments where I don't feel entirely normal, making me question if I'm ready to drive safely. I know it might sound dramatic after a year, but this is a real anxiety inducing fear for me. For those who drive, how did you decide you were ready after your procedure? Do you ever feel 100% normal and confident on the road? Any advice would be great. I would say to this one also, don't ignore your fears. That I think they're feeling that hesitancy to get their license for a reason. What do you think, Lupa?
I mean, I was pressured by family, just like peers around me to get my license a lot, but I never felt comfortable because of my myoclonic seizures, and I was undiagnosed for up until now. So, um, I'll never have my license, but if you're having the myoclonic jerks and whatnot, and they're persistent, it's best not to drive, in my opinion, because of the confusion they cause, and they're painful, and because of how you jerk, you could literally swerve the car into like off a bridge or into oncoming traffic or into a crowd of people, like, or you're
And that's even while being aware. Like you're not
yeah,
always
like
unconscious for those.
it's a quick jerk, but like it could cause, and instead of like seizing and being out of it, you're like confused after, and so people are gonna be like, what is that, and try and fight against it and whatnot. So I would suggest asking your neurologist about myoclonic seizures specifically, junior myoclonic seizures specifically. But
Yeah, that makes sense.
if they're upper body, which it seems like, they can be lower body too. For me, I had lower body ones that made me collapse, but typically they're upper body, um,
Mhm.
and you're aware for them.
Is it your arms? Do your arms flail out?
Usually it's your arms. It could be, for me, it's my entire,
Torso, right?
yeah, it's been like it got to like my entire body.
Wow.
So I would say that I had a severe case of it's junior myoclonic epilepsy because my brain's still developing, and I believe it cut off ages 20, but it could be 25. I'm not sure. But um it got to my whole body. It got to my legs. It got to my feet. Or not my feet. Oh, well, it got to my ankles. But normally it's up in the upper chest up region. So like my neck, head. Could even be my eyes, eyebrows. nose twitching, my lips, just like a lot of little twitching I have still that aren't as painful, but if they were to come on full blown, then they'd be really, if I didn't have my medication, then they would be very painful. I'd love to give you guys a example one day, but
No, it's
Andy,
okay. I have had those. That's why I was asking you about your arms. Do your arms flail out? Because my torso jerks like forward. It's more so like one side, my shoulder, and my arms flail out. So I would actually sit on my arms if I was sitting next to my husband in the car, so didn't hit him.
yeah,
So did you feel when they were coming? Did you get an aura for that?
It's hard to say. Um,
no.
it's almost like you're about to sneeze.
Yeah.
That feeling that you get in your body when you're about to sneeze. And I think that's why it's dangerous to drive, because I don't know if everybody gets an aura right before.
I know. For the myoclonic jerks, I get no aura. They just come and they are aggressive and
Yeah,
full.
yeah.
And if I was driving, it would be really dangerous because I wouldn't know what to do. Like I wouldn't know if I would take my foot off the gas, if I would hit the what if I don't know what I would do. I would just because I'm so out of it. It's like being awake for a mini seizure, a really small mini seizure. It's like being awake
Mm-hmm.
for that.
Yeah, that's not really safe.
Yeah.
So I agree.
I will be back, you
Yeah,
guys.
I'm actually gonna head out. I
Oh,
have to
All
go. I
right.
was about to
Thanks
say
for
that.
stopping in. No, totally happy to have you.